Hey, good afternoon and welcome to another edition of Health Sense right here on 1FM 91.3, supported by Glen Eagles Hospital. Now, the theme for today is Oh Man, where we talk about manly issues. Now, we're dispensing important health advice for viewers who are thinking of running the Standard Chartered Marathon, and we'll also discuss the Movember movement, which is also very, very important for men all over the world.
Our final guest today is a colorectal surgeon from Glen Eagles Hospital, Singapore, Dr. Ng Kheng Hong. Doctor, thank you so much for joining us.
Thank you for the invitation for me to speak here.
Welcome,
Now,
Doctor.
according to the Singapore Cancer Registry, about 1,500 patients are diagnosed with colorectal cancer annually. In Singapore, colorectal cancer is the number one most common cancer in men. 1 in 6.
Wow.
Wow.
Yeah,
Is a male patient.
Why do you reckon it's so common?
We're not so sure, but the thing we know about colorectal cancer is that as a country get more and more developed, more and more affluent, the people, the improvement in the diet and all this, and people start to live longer, and colorectal cancer become the number one cancer.
I realize it
Is
always
it-
comes
it's
back to
always
the
diet.
It's always diet related. It's always diet, affluence, and the way we are living sedentary lifestyle, more and more sedentary.
Yeah.
So we see that the highest incidence in colorectal cancer in countries like United Kingdom, United States, Europe, the more advanced country. You don't see the incidence in very much less developed country. The incidence is very low.
What are the symptoms?
The symptoms of colorectal cancer can be from very benign things like when you go to the toilet, you take a dump, you find that there's blood coming out, simple as that. Or you find that your bowel habit is no longer the same, maybe increasing constipation, or from a regular guy once a day become once every 2-3 days, constipation, or sometimes become once every 3 days becomes suddenly once a day. So there's a change in the pattern of the bowel habit.
Oh, it's not frequency, it's just a change in pattern.
Just change in the pattern. Because maybe somebody for all your life you've been going to toilet once every 3 days, and suddenly it goes very regular once a day. Something may not be right. So you got to ask yourself whether there's something wrong with you. Yeah.
These are just signs. I mean, it doesn't mean that
Yeah.
someone
Yes.
has colorectal
No, that's
cancer, but because sometimes I feel like it could be psychological as well. If someone is constantly having stomach pains and if they start to be bloated, they're a bit more sensitive to certain types of foods. These things might play on their minds as well, and they start to fear that they might be down with something. They might avoid going for a check, and then it's just a spiraling effect. What do you think about
Yes,
that?
this is very correct. What you're describing is what I call irritable bowel syndrome.
Yeah, right.
It's just that sensitive to certain food, coffee, caffeine, curry, chili, and then you get a lot of bloating, discomfort and all that.
Yes.
And because of all that, because these things are very common, all of us will have some of these symptoms at some point in our life. So people may want to put it off and say, it's just one of those, eating chili or having a change in their diet recently. So people put off their symptoms and they only come in when the disease gets very advanced. So it's very common to pick up colorectal cancer in the very late stage.
So the screening for colorectal cancer, is it a colonoscopy?
There are
what you
many
do?
ways to screen for colorectal cancer. The most basic way to do it is to send the stool for blood test.
Right.
Okay, this is called occult blood. Means something that you cannot see with your eye.
Right.
It's the stool, it looks normal, you send it for testing, it comes back as positive. So then you want to go on to do the next step, which is a colonoscopy.
Okay.
These are for people who are asymptomatic, meaning they have no symptoms at all, they are totally well. After the age of 50, you should try to go for some screening. So the most basic screening is actually a stool test.
Right.
Right.
Okay.
That's the reason why my doctor, because I go see a doctor every year for my screening, and a lot of my friends have said, Glenn, you haven't gone for a colorectal scan, colonoscopy.
Colonoscopy.
And I said, my doctor hasn't asked me to go for that. But every year, I give him a stool sample, you see, and it always comes back all right.
Yeah.
So maybe that's the reason why.
Yes.
Yeah.
You know.
I mean, I've been doing stool samples since I was 40.
Very good. So it's very good.
It was something my wife made sure I did.
But you've also gone for colonoscopy.
I have gone for a colonoscopy once.
No, why did you go for that if your stools were samples were okay?
Do you really want me to embarrass myself on this show?
Okay, then, forget it.
It was one of those.
Lunchtime soon.
No, it was one of those things that I said you've got to do once in your life, and that's all I'm going to say about it. Is there an alternative to a colonoscopy, or is that the only
Of course,
next
there are
step?
alternatives to colonoscopy, like what we call a CT colonoscopy. Actually, it's a CT scan. You lie down, there's a machine, there's an X-ray, you take a multiple shots of it, and they try to image the colon, reconstruct it in a three-dimensional view, and see whether there's any growth in the colon.
Wow.
CT colonoscopy. But this
How
is,
safe is that because of the
There's radiation and all
yes,
kinds
Glenn,
of
you're
things.
right. The most important thing is about this radiation. The radiation dose can be equivalent to about 300 to 400 X-ray in that 10 minutes or 5
wow.
minutes. So a lot of people may not want to go for colonoscopy simply because of the radiation dose.
Yeah.
And also because once you pick up something in the colon, maybe a small polyp, you may still have to go for colonoscopy to have it removed.
Yes.
Because we all know that it's almost a certain thing that this colon cancer comes from a tiny growth called polyp. And this polyp will take a long time, maybe 5 to 10 years, to become a colon cancer.
Wow.
So there's a pre-cancerous stage whereby you can actually go in and remove it and remove the risk or reduce the risk of colon cancer. This is something very unique because in most of the cancer like breast cancer, prostate cancer, there's no pre-cancerous stage whereby you can do something about it.
Yes.
But colon cancer has got a pre-cancerous stage. And
Yeah.
this pre-cancerous stage are called polyp and they can be removed during the colonoscopy.
Wow.
Yeah.
We've spoken about diets and in other areas we've spoken about exercise. It seems to be the same no matter what cancer we're talking about. Get the right diet, get enough exercise, and you should be all right. Are there any other ways that we can minimize our chances of developing colorectal cancer?
Well, of course, all the things that you mentioned help to reduce colon
Right.
cancer, stop smoking, healthy lifestyle,
Yeah.
manage your weight,
Yeah.
and eat healthy food,
Yeah.
eat less of preservative, artificial coloring, and things like that, more natural food or
Right.
organic food.
Right.
So these will definitely help.
Yeah.
But the most important, we think that to prevent colon cancer is to go for a check, for a screening. That's the most important thing. Because if you want to restrict your life to not eating red meat, not drinking alcohol, not smoking, and it's very difficult to
You might as
adhere
well
to
become
all
a
this.
hermit.
Yes, you're right. So
Even that is not a guarantee.
and that is
Yeah,
not
it's not a
guaranteed because
guarantee anyway.
the genetics still play a part. If
Right.
your parents or your
Right.
siblings or your uncles and aunties has got colon cancer, that increases your risk as well.
Right.
And staying in Singapore itself, in an affluent country, already increase your risk. So it's very difficult to say that just dietary modification, exercise, and all this will definitely reduce your risk to zero.
So are we looking at again the same 50 years old you should go and get a check, or
Well-
is it younger than that?
For anybody who is asymptomatic, means totally have no symptom at all, you feel everything is fine, 50 years old is the time to start.
Someone who has a family history?
You should start earlier, maybe as early as 40 years old, or people with symptoms like passing blood when you
Yeah.
go to the toilet,
Yeah.
bowel habit just become irregular,
Yeah.
or the sensation of not emptying everything when you go to
Yes,
the toilet.
yeah.
That's not right, something is not right.
Yeah.
So these people should try to do it before the age of 50.
Okay.
What's the process like before colonoscopy?
Okay, so for colonoscopy, the important thing is that this preparation process that people sometimes heard about it from their friends, relatives, and they get frightened.
Yeah, well, let's hear it from the doctor, and then we'll get the truth this time.
All right, okay, so the most important thing is that usually the day before or on the day itself, you need to drink a solution, it's a laxative, and you need to purge. You may need to go to the toilet like 5 to 10 times to get it all cleaned out.
Oh, wow.
Yes, you have gone through that before.
Yeah.
So
yeah.
this is the
I've
hurdle.
forgotten what it was like.
This is the hurdle whereby
forgot
people
about that.
drinking this
Yeah.
solution and trying to purge. This is a difficult part because sometimes, having an episode of diarrhea is so uncomfortable and then you feel
it's not nice.
exhausted after that.
Yeah.
So we try to make it better for the patient by not doing the night before. So we try to do it in the early morning, like 4 to 5 a.m. We let them drink the laxative. So they go to the toilet. By the time they are 10 to 11 o'clock in the morning, they are ready for the colonoscopy. So that shortened the process of not fasting and also
So they're staying in
reducing-
hospital overnight.
No, we can do that at home.
At
A lot of patients, in fact, prefer to do it at home. They get
Okay.
all the bowel what we call the bowel preparation done at home first.
Right, okay.
Then they take a cab or come with a family member
Yeah.
to the hospital and
Yeah.
we do the scope for them.
Right.
And once they're in the hospital, and how long is the procedure?
The colonoscopy will take about 10 to 15 minutes.
Oh,
It's
okay.
very fasting, so it's quite comfortable. A lot of time it gives a sedation, a bit of injection that put you to sleep. It's not general anesthesia though. General anesthesia require a lot more things than that.
You're more dopey. Yeah, okay.
So they will just give you a little bit of injection
Yeah.
to let you sleep. So
Yeah.
you're not 100% knock off.
Yeah, you're
knockout
not,
like general
yeah.
anesthesia. You won't know what's going on. You can't feel much pain, but
Yeah.
you kind of have a little bit of consciousness.
Yes.
So that makes the process safer than general anesthesia because you don't need to be so deep into the sleep. So
Right.
it's not like going for an operation. So the thing takes about 10 to 15 minutes and you will almost wake up immediately. And you ask the doctor, is it done?
Yeah.
Oh,
Yeah.
so it's very fast.
And because you're using such a mild sedative, people with heart conditions and all that don't have to worry.
You're right.
Correct.
Because we are going so mild on the sedation, people coming to 90, even 100 years old asking to do scope is not a difficulty at all.
So age is not a worry then
not a
because
worry.
it's so mild.
Yes.
I mean, in the worst case scenario, is the colon ever removed?
The colon, when it comes to the diagnosis of colon cancer, and then when proven on scan, biopsy, then the patient will go for surgery.
Yeah.
When we do remove the colon, we don't remove the entire colon, not just like Dr. Colin here talked about the entire prostate.
Yeah.
We cut a short segment of it. A lot of times it's about maybe 20 centimeter.
Yeah.
And the colon can be as long as 1 meter to about 1.2 meter long.
Okay.
So it's only a short segment removed. And most of the time the patient will end up not able to tell the difference before and after the surgery.
Okay.
And it will almost be the same.
Okay. Which means, I mean, a person who has part of his colon removed can still obviously lead a normal,
normal life.
Yes.
Okay.
It's only very unusual to find the colon cancer very low down in the rectum or very close to the anus. In these instances, maybe with the help of chemo and radiotherapy, not able to help it at all, we may still need to cut away the bottom part, but it's a very rare thing. Most of the colon cancer, we should be able to cut the intestine, join it back, and the patient going back to the normal life.
Right.
Yes.
Right. I mean, if you're watching us right now on Facebook, we are talking to Dr. Ng Kheng Hong, who is a colorectal surgeon at Glen Eagles Hospital, Singapore. And if you've just got news that you might have to remove your colon, I hope you've been encouraged by what the doctor just mentioned.
Absolutely. I think a lot of people hear about this and hear about colonoscopies. I'm glad you've cleared up the fact that it is not a painful procedure, because the imagery is painful. The sheer imagery of a colonoscopy is painful.
That's right.
And I think that's something that we do need to dispel.
Yeah.
Yes.
And I think it's on a lot of people's minds these days, because I've noticed this. Many people have stomach issues in Singapore.
Yes, it's very common because in Singapore there are a few important things. First of all, we are very stressed. So when we are stressed, we are not eating regularly.
Right.
We are not eating the right food. So you may just go for a simple food in a hawker center. May not be a well-balanced diet. So stress is one thing, irregular meals. And of course, right here, we eat better food and a lot of time very processed food as well.
Okay.
Okay? Just looking at a bottle of ketchup or chili, you can see the number of preservative, artificial coloring, everything right inside. So it's just pure chili, or it's chili with a lot more other things inside.
Right.
So these are the things we need to ask ourselves when we are in a very affluent country. Our food become very refined, and we are no longer eating the vegetable as vegetables. So we eat it at more processed vegetables and more processed meat and all that. So these are the contribution to a diet that is not ideal.
Right. So it's nothing to do with one's childhood and perhaps maybe during his or her childhood they weren't eating a certain type of food, and so because I've got friends whose stomachs are so sensitive, they almost know what types of food will trigger off their sensitivity.
My daughter is exactly like that. She's got two different foods that just trigger her stomach.
It's like they can't take vinegar, not too much, not too many fruits.
Yeah.
It's going to make them feel bloated.
Yeah.
And things like that.
Yes, this is
Same
what we
thing.
call irritable bowel syndrome.
Yeah.
Intestine being
Yeah.
very sensitive to something.
Yeah.
If you look at it, the same analogy will be skin allergy. In about 20, 30 years ago, we don't see children with so much skin allergy. almost like rare to see people have so much allergy. Now you can see kids with peanuts allergy,
Yes.
certain allergy. So these are, it's exactly like what we have in our intestine. We're allergic to certain food because we get exposed to a lot more food now
Right.
compared at 20, 30 years ago when
Right.
food are so simple. You either eat porridge in the morning, then you have some meat in the afternoon, night some vegetables. These foods are more primitive food and they're more original.
Right.
Right now we are exposed to all sort of food. We're exposed to all sort of allergen as well. Flower, plants, plants from South Africa, plants from another part of the world.
Yeah.
We have pets. We have lots of all different kind of dogs. We have all different kind of cats.
Yeah.
We have, we're exposed to a lot more things than somebody else who's, let's say, living in a certain part, more deserted part of the world.
Yeah.
Right? Then you have less exposure to all these things, and you're less likely to have skin allergy. You're less likely to have food allergy as well.
Let me ask you a question. I have an issue with my daughter when it comes to food. My youngest daughter, she is a massive mala fan, and I believe that cannot be good for your system. Not when you eat it to the point that your lips go numb. Surely that has got to do more bad to you than anything else.
Yeah, well said. Because what it's doing to your lips, it will be doing to your esophagus,
Sorry, don't worry.
stomach, and maybe to the rest of the digestive organ as well. It's just the intensity of the burning that's causing to it.
It's literally burning your system.
But
isn't
someone
it?
once told me spices are good for the lining of the stomach. It strengthens the stomach.
Anything in moderation is good for the stomach.
Yeah, I've heard red chili is good for you.
Red chili is good for you if you just take it 1 or 2 pieces. If you take like one whole bowl of
it, yeah.
You're just putting so much stress to your stomach. It's just like Dr. Tan talking about exercise and taking a 24 kilometer, 36 kilometer versus a 5 kilometer run.
Yeah.
Everything in moderation, our body knows how to deal with it. There's regulation in the body. Our body knows how to take care of cancerous cell. Our body knows how to take care of very strong food, but in moderation.
Yeah.
Right.
You overwhelm the body capacity to neutralize the acid or the coffee, the whiskey you're drinking, then you cause harm to your body.
Right.
Yes, our hot body is not so fragile, but nonetheless, it cannot take the stress of something that's 10 times the volume of mala.
Yeah. Yes.
10 times the red chili or green chili that you're taking. Same thing, I think, applies for running, for jogging, for exercise.
Right.
Our body has ability to cope, but only to a certain extent.
Yeah. I think what's important is that, we need to be wise.
Yes.
We need to be wise when it comes to our choices.
How are you wise when your choices are bubble tea?
Bubble tea.
Now those bubbles, I'm a father, I go through this all the time. Bubble tea, those bubbles, they can't be good for you.
Someone said they're very hard to digest.
Yes, you're very right, because when we do colonoscopy, sometimes we see all this food that's non-digested.
No.
For example, when the patient had bubble tea the day before or eat lots of mushroom, even with the bowel prep, you finish, you clean everything and go to the toilet 10 times, you put a scope in, you can see the mushroom intact. You can see bubble tea floating inside, the bubbles floating inside. No. Non-digestible.
Oh boy.
Because it's very difficult for the body to digest these so-called foreign things that's not properly cooked and not in proper pieces. Our gastric juice just cannot do that.
Right.
And then this causes a lot of bloating in the tummy, and then in the long run, it's just causing stress to the intestine.
This is not the first time I'm hearing a doctor say that mushrooms are
We've heard this before.
digest.
Yes.
Yeah.
We've heard this
We've
before.
heard this before, that the enzymes in your system just can't digest the mushrooms.
What is it about mushrooms? Then maybe we should stop eating mushrooms.
Yeah, why did my parents always tell me to eat mushrooms?
Okay, the difference is that the intact mushroom, a lot of people just swallow it down. It's very easy to swallow down. One of the most easy things to swallow is mushroom. It's so smooth, it just goes down, slime, it just go down right away.
Right.
So that makes very few people wanted to chew it.
I see.
Okay? So every part of our digestive system has a certain role.
Okay.
So people who chew their food, 5 minutes, 10 minutes, take a long, nice dinner or lunch, they chew their food, then they pass down the food to their stomach, and the stomach will start making it to like porridge-like kind of slime thing, and then it pass on to small intestine. So every part need to do a certain job. Now, if we're in a hurry, we take our meal in less than 5 minutes, like I always do. So it's just causing a lot of no
don't chew
mastication, no
Yes.
chewing. So everything is delivered to your stomach.
Yes.
And the stomach got to do a lot more work trying to break down all this food.
Yeah.
And if the stomach says, I had it enough, let's pass it down to somebody else, the small intestine.
Right.
And the small intestine, I'm not used to chewing food. I'm not supposed to be doing this part of digestion.
Right.
So the whole system is just not doing the right thing. So people have a lot of symptoms of bloating, discomfort. People who have less problem with digestion are people who take their time for a meal. Sit there,
Right.
sips of wine, chew, talk, swallow.
So the good European
Yes.
3-hour lunch is what we should be
Correct,
doing.
Exactly.
Yes,
and my
that's
mom
all.
used to tell me when I was growing up also, make sure you chew your food. Chew your food.
There was a rule. What was it? Chew.
10 times.
Is it 10
And then
times
swallow.
or 20 times on each side or something?
Let's make it 100 times. How about that?
Wow.
That's pretty much mush. Dr. Ng, thank you so much for joining us. Very, very insightful. Thank you.
Thank you.
Thank you very much for your
Thank you,
time,
Glenn.
Doctor.
Thank
We've
you.
learned
Thank
a
you,
lot.
FD.
Thank
Yeah.
you.
Thank you.
You've been watching Health Sense right here on 1FM 91.3. We've been live on Facebook. And we've had a great time with all the doctors today. Health Sense, of course, is supported by Glen Eagles Hospital.
We'll see you again next time.
Good times. Greatest hits. 1FM 91.3.